and regulations in the town and country planning department much more easy and much more accessible to the common man. Let him take benefit. Let him enjoy a better quality of life. I think it should be opened up. Let everybody have, if they want, they can go, and if they want, if tomorrow if you have if you have a bigger building, then you are eligible to X amount of FSI. And if it's a smaller area, then you cannot get, if you cannot leave those setbacks, then automatically you will not get those. But then he should not be at the mercy of the government or anybody to decide whether I should not be the person to say that no, I will allow you to build, I will not allow you. It's not like that. What we are saying is the policy should be an open policy. Once it's an open policy, people can go and decide and build the way they want.
Sir, one more thing is that about the urban and settlement, it is a 100 years old building and the structure is almost to come down. So you are looking after that.
तुम्ही एक लक्षात घ्या की हांव जेन्ना हेल्थ मिनिस्टर जाला 16 वर्सां पयलीं तेन्नाच्यान तुमी वेगळ्या तरेचे हेल्थाचे इन्फ्रास्ट्रक्चर करपाचो हांवें प्रयत्न केला. हांव म्हणना की 100% सगळ्या गोष्टीन यश गावला. खुबशे गोष्टी करपाक जाय, खुबशे आमकां डॉक्टर्स घेवपाक जाय. हें इट्स अ ऑनगोईंग प्रोसेस. आतां पयर कोणी तरी उल्लेख केलो की सावथ गोवा बरोबर आहा. सावथ गोवा डिस्ट्रिक्ट हॉस्पिटलान आमी आतां रिलायन्स फावंडेशन कडेन आमी टाय अप करपाचो आमचो प्रयत्न चालू आहा टू हॅव टेली ICUs सो दॅट वी हॅव अ हब एंड स्पोक मॉडल. Interventionist to get is very difficult. So we have to figure it out. Cath lab also, there is a proposal in the pipeline. We want to see that it is taken forward in a very aggressive manner. हे सगळ्या गोष्टी करपाक नाका शेवट केन्ना केन्ना जाता बिकॉज यू नीड मॅन पॉवर, यू नीड स्पेशलायज मॅन पॉवर. तुम्ही जे सांगता ते सारकें आसा. जुनी बिल्डींग आहा, नवी बांदपाक जाय. पण आतां एक प्रोजेक्ट पणजे म्युनिसिपालिटीन जर ठरयलें की ते दिवपाक, आतां नॅशनल थिएटराचे आतांच आतां CEO कडेन उलयता, ते लोकल MLA कडेन उलोवन ते आमकां सांगतले कितें करूंक जाय ते. समजा फाल्यां जी सुद्दां बांदता मागीर तेंचे कडेन चर्चा करून काही एरिया आमी तेजे कडेन बी दवरूंक शकता. पण ते अल्टिमेटली पणजेचे बॉडीन ठरोवपाक जाय. त्या प्रमाणे आमी ते फुडें व्हरपाक जाय. बिकॉज यू हॅव गॉट अ शॉर्टेज ऑफ स्पेस इन द सिटी. यू हॅव टू फिगर इट आउट. बट येस, we can, because if the TB chest hospital moves to Bambolim, then we can actually build a better, it will be in between Taligaon and Panjim, and we can have a good non-bedded facility there, with a state-of-art facility. We can do it, but multiple things are there. We have to see that what we have taken in hand, we complete and move forward.
आणि कंप्लेंट आमचे फुडें येयली की डिस्ट्रिक्ट हॉस्पिटलांच्यान रिकमेंड करता तुम्ही प्रायव्हेट हॉस्पिटलांत वच म्हणून. तुजी
चुकीची समज आहा. आनी जे कोण स्टेटमेंट्स करता कित्याक हांव गोवा मॉडेलाचेर चड हांव उलयता ह्या दिसांनी, आनी दिल्ली मॉडेलाचे कोका मॉडेल म्हणून हांवें सांगलें, आनी एब्सोल्युटली रबीश मॉडेल. हे लोकांक केन्ना केन्ना लागता ते न्ही. आमी कितें करया आतां लागता जाल्यार गोवा मॉडेल आनी गोंयची जनतेची सेवा करपाक म्हणून आमी हांगा बसल्या. पण तुम्ही जर दुसरे कडेन पळयल्यार मुद्दम वचून पळोवन या, तुमकां कळटलें की मुद्दम आमचे कितें चुकता म्हणून चूक दाखोवपाक म्हणून प्रूव करपाक गेल्यार दॅट्स नॉट द वे टू लूक एट इट. तर यू बेसिकली वॉट हॅपन एज पर द पेशंट इज कन्सर्न, I phoned up immediately when I got a message from the concerned MLA, is that I phoned up the director. Everything is in black and white. It's not in just I am saying it. पण कितें आहा, थंय ICUची थंय आमकां स्टाफींग करपाची गरज आहा. आमी करता, मुख्यमंत्री कडेन हांव चर्चा करून ते फुडें व्हरपाचो म्हाजो प्रयत्न आसतलो. पण त्याच बरोबर आमी त्या पेशंटाक आमी विनंती केली की शी वॉन्ट्स टू बी शिफ्टेड, द पेशंट वॉन्ट्स टू बी शिफ्टेड टू गोवा मेडिकल कॉलेज because of the ICU bed, and we would have shifted immediately. But then definitely in South Goa District Hospital, as we speak today, there is no ICU facility. And ICU facility to commission, you require interventionists, you require all the equipment and all we have got. But we need that type of staffing and specialists. Now we are doing Tata Memorial, but आमी टाय अप केल्ले आसा. काही डॉक्टर्स आमकां थंयच्यान आमकां रेकमेंडेशन घेवन ते आयल्या. ते हांवें ऑलरेडी सेक्रेटरी हेल्थाक ऑलरेडी नोट मूव केल्या. ते सेक्रेटरी हेल्था कडेन नोट मूव करून जे डॉक्टर्स अवेलेबल आहा, जे डॉक्टर्स येवंक सोदता गोंयान काम करपाक, मॅक्सोफेशियल सर्जरीचे ऑन्कॉलॉजिस्ट आनी ऑन्को सर्जन्स, आनी तेजे भायर जे जे वेगळे फिल्डाचे ऑन्कॉलॉजिस्ट येवंक सोदता. आमचे आतां 10 भुरगीं आतां नर्सीज आमी पयर टाटा मेमोरियलान धाडल्या, कित्याक 10च आमकां सीट्स गावल्यो. तेजे भायर शॉर्ट कोर्सीसाचे खातीर आमी तांकां धाडटले. वेगवेगळे पोस्टाक आमकां जे धाडटा आमी धाडटा, पूण ते आमी घेवंक शकता, ते घेवपाचो आमचो प्रयत्न आसतलो.
फिलअप जातले तुमचे
वेळ लागता मातसो. इट्स नॉट समथींग ओवरनायट. डू गव्हर्मेंट एज अ प्रोसिजर, आनी हे सगळें करपाक इट इज नॉट इजी. आमी आतां ह्या स्पिडीक वयता म्हणून एटलिस्ट आमचे खुबशे गोश्टी आमी मार्गार आमी घातल्यो. पूण हे कांय गोश्टी स्पेशलिस्ट गावप, त्या तरेचे डॉक्टर्स गावप, त्या तरेचे लोक आमचे बरोबर येवंक जाय, तांकां आमी ऑन बोर्ड घेवपाक वेळ लागता.
एकीकडे तुम्ही म्हणताय की दिल्ली मॉडेल मध्ये दम नाही,
बरोबर
बाजून म्हणताय की वयाची टीम पाठवून ते काय काम केले ते बघायचे.
मी सांगितलं नाही, मी म्हटलं मीडियामधून काय टीम, आमची टीम म्हणलं नाही, मीडियामधून तुम्ही आणि 4-5 असे लोक जाऊन बघायला की बाबा गोव्यामध्ये काय चाललंय. आणि ॲक्च्युली तुम्ही बघायला गेलं की कार्डियक फॅसिलिटी आता 29 सप्टेंबरला आज 29 सप्टेंबरला आम्ही वी आर गोइंग टू 3 कॅथ लॅब मशीन्स वी आर गोइंग टू कमिशन. मग मे बी अनदर 5 days 10 days एक्स्ट्रा आम्ही आता IVF फ्री आम्ही केलं. त्याचबरोबर टाटा मेमोरियलची OPD आम्ही स्ट्रेंथन करायचा आमचा प्रयत्न आहे. गॅस्ट्रो फॅसिलिटीज आम्हाला या महिन्यात आम्हाला कॉन्क्रीट आम्हाला येणार की कसं आम्ही ते चालवणार आहे. डॉक्टर अमित मैदेव, डॉक्टर अलवारीस यांना सगळ्यांना ऑन बोर्ड घेऊन कसं करायचं, हाऊ डू यू डू इट, अँड वी वॉन्ट टू डू इट. यू नो यू अंडरस्टँड वन थिंग, लॉट ऑफ कॅन्सर्स आर इन अँड अराउंड युअर स्टमक. And as a result of which today you find that even the richest person getting pancreatic cancer and several other cancers, and as a result a whole family gets destroyed if the main earning member gets this type of disease. So what we are trying to do is trying to see that we have a state-of-art gastro facility. You will see, I'm just waiting for them to finalize in another couple of days. I think on the PDF I had seen that one proposal has come. Once that comes, within 3 months from that day, we will make sure that 3 months from the day I and doctor finalize, we will make sure that we are able to commission this facility for the people of the state of Goa, and it will be a very professionally run facility. Now in the new super specialty hospital, what are we looking at? We are looking at now, one is Dr. Madhu Prabhu Desai is running this nephrology and other facilities. Then after that we'll have a cath lab, one for cardiac related facilities. Then we want to have the IVF. Then we have a gastro, and then latest diagnostics we want to have. Many times lot of things are very expensive, so we need to look at various models by which we can run, and how are the models that we can run, what are the models that we want to run. I'm being very honest. Today I told you just now, any document you want, you come and see and have a look at it, because sometimes some things are there are hurdles in certain way when you want to do something, because that's how it is. And that's how you need to overcome these hurdles. You have to overcome, because many times somebody doesn't send some document from somewhere, as a result of which we have to then wait and see what their view is. So I had gone to Reliance also. I had spoken to the foundation. I had spoken to them. They are offering to support us in having this hub and spoke model and several other facilities in which they will invest with us.
What model is it?
Hub and spoke means also the peripheral areas also are covered. So basically it's not easy, when I tell you, because the state has multiple issues and multiple other departments also to take care of. It is not only one department to take care of. So as a result, my job is to first see that the super specialty hospital is fully commissioned, so the people from Goa, and the cancer hospital is made available and ready at the earliest. Same side, in the forest department also we are seeing that how do we open up. We want to come up with the latest, we want to utilize the wildlife sanctuary in the best possible way. The community is also strengthened, the people also are strengthened, economically it's strengthened. So we are talking, there are various activities such as organic bee farming you can have in the wildlife sanctuary area, and then we can encourage and empower the community to earn money out of it. Ultimately, what is it? Then also you find, you will be wondering that what yesterday UP Chief Minister also has made a statement on giving more money, because it's an agro-based economy, giving more money to people who are having these cattle and look after adopting these cattle. So we want to see whether such a thing or a cow reserve, whether it can be made within the wildlife sanctuary area. So I have spoken to the CP Goel, DG of Forest, to see whether these type of things happen. How can we do it? There are multiple ways of doing things and looking at things. I am talking in the periphery only of my portfolios. Then how to release, how to make policies that are very people friendly and people can access and do things. Suppose in rural Goa, you want to build a house, you want to develop something, or you want to have a bed and breakfast kind of thing, you want to extend. What is the policy that I need to bring? Last time Chief Minister and myself, we sat on the steering committee and we passed several things. As a result, is there anything more required to be tweaked? Is there something that has to be done? Is there something that will benefit the people? So when we talk about interland tourism also within the forest department, forest protected areas, I can't give it to any other agency. It has to be, GFDC is the nodal agency, and that's the only agency that will be allowed. Otherwise, forest department will be doing it. Now you have to understand, suppose a husband is from Mahe. So in Mahe, if he wants to build, I'm giving a concept. If he wants to have, he has a house. Around the house, if suppose he wants to have certain extensions, then how does he do it? Suppose that area is not settlement. What is the way forward? Ultimately, even Hafiz contractor spoke to me. We have taken him on board. We have written to him. We are waiting for him to give a feedback. The unique structures, when anybody takes benefit of the regulations and a higher FSI, they will have to maintain the roof facade and everything pertaining to the Goan, the most Goan inherent characteristics of a Goan and Goan, the state of Goa, what it identifying with the state of Goa is the type of policies that we have in the pipeline of bringing. If you think that I'm going to give a higher FSI to somebody and he can build any type of building and anything, I'm not going to be allowing that. He has to give a commitment in writing, and only then we will be allowing him to take this type of benefit. So this is how we want to move forward, and this is how we want to make it more people friendly. Many times people feel X is happening while you go to the remote villages. Today people in the villages are asking for development. People in the South Goa are asking for development. People want to go beyond the regional plan and ask for development. We want this type of development. Today the families have grown. So if a person wants to do a development and build a house beyond a particular thing, then he has to be allowed to do it. Why should we wait for the government to take a policy decision when the government takes a decision, and why should we put the people at the mercy of the policy making bodies like us? Instead, it should be more people friendly, where people go and buy the FSI and take it and buy it, build it. This is how you have to do it. My job is to see that within the next 6 months, Goa will have a new Town and Country Planning Act, and we need to do it. We need to have a comprehensive 30, 40 years, because the Town Planning Act was this original one was initially brought out by my father when he was early in the 70s. Now the time has come for change. Now you look at the way the Honorable Prime Minister Narendra Modi ji also has brought in the Forest Act, so many amendments have been brought. I also tweeted the other day for infrastructure projects to make it much more easy to move forward. So basically, and several other issues I've already tweeted on that. But that is how one has to look at it. Suppose you want to build something, you should not be at the mercy of me to give you permission. You should be able to go to the department and get permission on your own. Ultimately, a common man living in the village, poor fellow doesn't know what he's doing. He is actually building his house on orchard land. Am I good? How many times you are going to take action in? When you are doing a zoning plan, you need to see that all these issues are addressed. All the houses are incorporated on all this, so that he is able to live a very comfortable life without any kind of stress that whether he is zoned. Wealth has to be passed on to everybody. Wealth has to be passed on to the poor man also. A simple person also should feel empowered through the policy making of the government. That's what I feel.
Why the panchayats always blame?
No, I don't. I can't comment. No.
Sir, they always put a blame on TCP.
TCP is the only department that is technically competent to give any kind of permission. And also, second time, you find that many times the people have got contrary views to contrary things. My job is to go as per rule and regulation. I am not really worried about who's saying what is happening. Some people who are not happy with the decisions you take, but ultimately Goa has to progress. You cannot have a state as status quo. It has to progress. You'll agree with me that if you open up a policy and if you create a type of a vertical for a person to go there and he is able to go and benefit out of it, and he gets benefit by a policy, and he doesn't have to be remaining at my discretion, and he can go and approach the department and take whatever benefit he wants. Like I made that policy for all the housing societies and everything. Everybody has welcomed it. There have been several editorials on it. I'm grateful to the editors for having written so much about it, because people want it to be implemented in a total spirit of what I have mentioned, and we are going to implement it. When we have got people like Mr. Dempo and Milind Ramani and several other people sitting on the board, then we must make sure that we are able to implement policies which are benefit for the people. Go and look at some societies, several, फोंड्यान वचून पळयात, मडगांव वचून पळयात, हांगा पळयात, तुम्ही पळयतले की खूब कडेन अशें पडपाक आयल्या सोसायटीज त्या सोसायटीक जर तुम्ही योग्य तरेचे तुम्ही FSI दिवंक ना, म्हाका कोणूच इंट्रस्ट दाखोवचो ना ते बांदपाक. आनी प्रत्येक मनीस तुम्ही हांगाच्या रुमान जे सगळे प्रेस मिडिया भाव आनी भयणी बसल्या, प्रत्येकाक दिसता की आमकां बी त्याच तरेचे लायफस्टायल जाय जे श्रीमंताक आनी व्हडल्या लोकांकूच लायफस्टायल कित्याक जाय, की भायल्या लोकांक तुम्ही भायले म्हणटा, कोण बिल्डर म्हणटा, कोण जाय ते नांवां दवरल्या तुम्ही, पूण ते तांकांच कित्याक बेनिफीट वचूंक जाय. गोंयचे जनतेक आनी गोंयचो तो स्थानीक जो आहा ताका बी मेळपाची गरज आहा. आनी म्हाका दिसता की हांव जो पर्यंत आहा तर म्हाजी तेच तरेची मनस्थिती आसतली, आनी ते हांव पॉलिसीचे माध्यमांतल्यान हे ओपन अप करपाक जाय. हे टाउन प्लॅनिंग डिपार्टमेंट should not be at the discretion of one man or one person or one minister who is sitting here, but in fact it should be a policy that is appreciated by the people and we take it forward.
बरं, आणि अशी की टायगर रिझर्वाचे
थोडं एलोबरेट कर काय काय
SOPs म्हणजे आम्ही आज त्याला डेंग्यू समज डिटेक्ट झाला, मग तुम्ही किती तासांनी त्याचं परत प्लेटलेट्स टेस्ट करणार, त्याच्यानंतर तुम्ही काय करणार, काय मेडिकेशन दिलेलं आहे, समजा आता डेथ झाले ह्याच्यावर बी आम्ही रिव्ह्यू घेणार आहे ऑलरेडी रिव्ह्यू घ्यायचे आम्ही ऑलरेडी ठरवलेलं आहे. आणि हे लोकांना आम्ही काय अवेअरनेस करतो, आमच्या माध्यमातून काय कितींदा टेस्ट केले, आमच्याकडे केले टेस्ट का बाहेर केले टेस्ट, बिकॉज वी हॅव टू ऑल्सो टेक अंडरटेकिंग दॅट यू शुड कम ओनली टू आवर हॉस्पिटल टू टेक अ टेस्ट. दॅट रिझन इज बिकॉज टुमॉरो हू नोज देन वेअर अँड व्हॉट हॅज बीन डन, बिकॉज वी नीड टू सी दॅट द रेकॉर्ड ऑफ द पेशंट इज मेंटेन. In a day, if you don't take it for 2-3 days, suddenly you can find within the reasonable range what is supposed to be there, it will go much below. And if it goes to 36,000 or something, then a person can go into other complications. As a result of which, it is important for us to manage this well. That's why we had a detailed comprehensive meeting of all the departments today to see that we take this forward.
One TCP and one health. TCP,
Both.
the new law that you're talking about within 6 months. Has any base work started on it already?
No, we are speaking to several people. We are seeing the best practices everywhere. And I am going to make it very transparent. We are going to take people from different places. There are a lot of people who are not from Goa, but they have got that feeling of they stay in Goa, but they want that type of architecture and other thing to be maintained. But then how much, I asked a question to somebody, how much will I be in a position to enforce this law? You agree what I am saying? You see, when my father was chief minister in those days, he used to come under a lot of criticism from these lobbies, because he used to say you must have a tiled roof, you must have that type of facade. But I think time has come now to have that. Whether you want to avail of the regulations, have it. You don't want to avail of the regulations, then don't have it.
And second question is, you had spoken of a private medical college in the southward district.
It is a necessary. See, I have already moved a file because to form a committee. Let the committee examine what are the best practice model. There are many models that are available in which the state governments are working. In Orissa there is a model, Assam there is a model, then you have a model in 2-3 other states there are models. So basically we need to see what is the best model that is available so that we are able to provide. See what happens, I'll tell you, South Goa District Hospital is a very huge hospital. And I need some support system to see. This is nothing to do with everybody who has got DDSS. Honorable Chief Minister's opinion that we have to go for CGHS rates. So they are working on it. So CM will take a final call on it. But my own thing is that if you do not have some partner to handhold you, it will become very difficult to run that hospital. So you cannot have a replica of a Goa Medical College or a super specialty hospital in South Goa. But people of South Goa expect that you should do it, and we should be doing it as a government. So it is tough sometimes, but we have to see what is the best model that will help handhold us in order to provide the best of benefit. See, when it's not about privatization, nobody is going to privatize anything. It's only the education institution that will help in supporting the existing health facilities in that particular area. Nobody is going to give that building or the facility of South Goa District Hospital to anybody. We are talking only education and a medical college to be attached to the South Goa District Hospital. Nowhere have I said privatization. Nowhere I said that I am going to hand over. The medical superintendent and the whole staff will be ours only. But then how do I handhold, and how do people of South Goa have waited for too long? We need to give this benefit to them, and we have to. I will sit with Chief Minister, and we have been talking on this for quite some time, and we'll figure it out how to take it forward.
टायगर रिझर्वाचेर तुमी कोर्टान वचपाचे आशिल्ले तेजेर कितें?
आयज म्हाका जी म्हायती आयल्या, आयज कोर्टान हियरिंग जाली आनी ऑलरेडी NTCAक बी नोटिसीस इश्यू केल्या सुप्रीम कोर्टान. NTCA आनी मिनिस्ट्री फॉर एनवायरमेंट फॉरेस्टाक ऑलरेडी नोटिसीस इश्यू केल्या. ते एक्झॅक्ट म्हाका डिटेल येवंक ना. फुडली डेट जेन्ना जातली आमकां आनी क्लॅरिटी येतली की कितें जाता. When it is already in Supreme Court and the matter is being heard, it is not advisable that I say anything on that.
So you can always divulge about the contention.
I can't.
Forest department has. Can you place something before the court? कि वो आमका याद झाली खातीर आम्ही हे करतात.
ते तुमच्याकडे येतलेच नाही. प्रेसाकडे विचारणारे कोणाकडे येतले ते. आमचे कंटेन्शन कितें, आमकां कितें जाय, कशें हे सगळे गोष्टी घडटा, कशें घडून आयले, हे सगळे गोष्टी इट्स ऑल इन द सुप्रीम कोर्ट. सो लेट इट गो एज पर.
Sir, can you update this? You have been given in charge of.
No, that is nothing to do with Goa.
No, not in Goa, but you have been given. So how do you see your?
Nothing.
GMC कांयचे मॉडर्न फ्रेंड्स आनी ना त्या खातीर पेशंटाक त्रास जाता.
आमकां मातशे कांय गोश्टीचेर थंय चेंजीस करूंक जाय. चीफ मिनिस्टर कडेन चर्चा केल्या आनी जे कडेन कितें हें करूंक जाय, आमकां आनी एक फेसिलिटी मॅनेजमेंट एजन्सीज ऑन बोर्ड घेवंक जाय. म्हणजे ल्हान गोष्टी आमी तेंच्या माध्यमांतल्यान आमी करून दिवंक शकता. तेजेर चर्चा चल्ल्या, खंय तरी सोल्युशन आमी काडपाचो आमचो प्रयत्न आसतो.
पण मेंटेनन्स टीम
आसा हाऊसकीपिंग मेंटेनन्सा फेसिलिटी मागता तो जे म्हणटा फॅन खंय तरी तुजे लॉक वयता बाथरुमाचे मेंटेनन्स आसूं दी तेजे काही वेगळे तरेची एजन्सीज आहे
काय वॉर्डन एक्स्ट्रा पेशंट घालता तांकांय मागीर प्रॉब्लेम जाता
आयजची दिसा एक्स्ट्रा पेशंट म्हाका दिसना
142 आणि 144 वॉर्डन
मेडिसिन वॉर्डान ते आहात ते इज रेग्युलर मेडिसिन वॉर्ड इज ऑलवेज ओवरलोडेड आणि म्हाका दिसना आनी खंयच्याच वॉर्डाना हांवें लक्ष दवरून म्हाका रोज अपडेट येता म्हाका दिसना थँक्यू सो मच आणि लास्ट हांवें विसरलो सांगपाक तुमकां हांव सर्क्युलेट करता हे आमी इंडियाज फर्स्ट 10 TPD प्लास्टीक वेस्ट टू फ्यूल पेंडींग आशिल्ले खूब दीस आतां तुवें ते आमी ते चालू करपाचें हांवें तांकां आपूण हाडून सांगलां की फुडल्या म्हयन्यान ऑक्टोबर 30 तारखे पयलीं ते चालू जावंक जाय
This is that Penne project.
Perne project. I have called them, told them what I have to tell them, and I also am sending the secretary to. Secretary is already discussed with me. We are also ensuring that this starts. There is a bigger plant coming up in Varanasi. One is coming in Lucknow, but this will be very useful if it functions, works very well. So I'll just leave a picture where we'll be having about 100 collection points at different places. So it will be useful for us. If this works, it will be very good for us that we are able
Challenge
to.
is for continuous supply. That's the challenge.
No, challenge is there, but see
Plant
this.
stops working and to restart it is.
No, challenges are
Cost
never.
effectiveness.
No, challenges are there only. But I think there's enough this thing available. So let him. This was actually initiated earlier. I think this is a project is pretty interesting.
2008, very old.
So it had to commission. No, our money is involved there. So we had to get it commissioned. So I've given them time till 30th before 30th October to start it. This was actually taken at 2 m. Then they had apparently suggested that we will have one more in south. But I said first to start your production, we'll observe it for a year and then we'll decide about other places.
ते कोणत्या हॉस्पिटलची डिजिटलायझेशन करपाची कितें प्रोसेस आसा म्हणजे
You have something written on that project?
Yeah, you can just share it.
Program has already started.
Can
Digitalization.
you brief about
Yeah, these portals are there.
Are they portals?
Portals are coming which digitalization is happening.
बरें